Dr. Tracy, board certified general pediatrician, and let's talk sinus infections in kids. This is a really hard one because it's really hard to tell what they are. And I think a lot of parents don't even really understand what the difference is between a sinus infection and upper respiratory infection. So let's talk about it. A sinus infection just means that you have mucus or fluid that has built up in the small air cavities that are in your face and skull. They fill up with fluid and they create a lot of secretions. So that's what a sinus infection is. Whereas an upper respiratory infection, the sinuses are clear, there's just nasal congestion and postnasal drip. So a sinus infection itself does not tell you whether it is bacterial or viral. And if you remember, viruses have to get better on their own. They don't need antibiotics, but bacteria do need antibiotics in most cases to get better quicker and with less complications. So how can you tell the difference in your child? And how does your primary care provider tell the difference in your child whether or not there is a sinus infection from a virus or a bacteria? So here's some guidelines that we have. This is the best practice at this time. We wish we could do a quick bacterial culture and tell you, yep, this one's bacterial, nope, this one's viral, but it doesn't work that well. It takes 3 to 5 days to come back, and you can live with bacteria in your nasal passages. It doesn't mean they're the ones causing the infection. So the only real way to tell is actually to put a needle into the sinus, which no one's going to do. So here's our best practices as of now. If your child is over 6 months of age, they have a fever over 102 and thick, copious nasal secretions for more than 3 to 5 days with a cough, they likely have a sinus infection. It's likely bacterial. If your child has viral symptoms with nasal congestion, cough for more than 10 days, most viruses, right, are going to last anywhere between 3 to 10 days. After 10 days, there should be some improvement. You should be able to say, well, the cough is better. The congestion is a little bit better. There's times when I forget my child is sick. They may run down in the evening a little bit, but they should be improving. So if there's no signs of improvement after 10 days, more likely that it's a bacterial sinus infection. If your child had a normal upper respiratory infection symptoms with cough, congestion, low-grade fevers, they started to improve. And then after a day or so, really went downhill pretty quickly. That is much more likely to be a bacterial sinus infection. So how do you know when to call your doctor? It's exactly those reasons. If your child is over 6 months of age, had a fever for more than 3 days, cold symptoms, you should call. We need to see them. If your child has been sick for more than 10 days, even if they don't have the high fever, even if the symptoms aren't severe, if it's more than 10 days, it's not improving, we need to see them. If they got well, got sick again pretty quickly, we need to see them. In those 3 cases, it is appropriate to use antibiotics because there's a higher likelihood that it is a bacteria. It will take longer to get better without it. What are questions that you should ask if you see your primary care provider with your child and they state they have a sinus infection? First question is, do you think it's bacterial or viral? It's okay to ask. A lot of us are still trying our best to be better at not prescribing antibiotics, but the community expectation is such that makes it really difficult. We also do really care that your child doesn't feel well. We want to try to help them feel better. We know you've likely had to take time off of work. They can't go to daycare. They're missing school. So sometimes our empathy kicks in too much. And we need to be reminded, like, do we really need an antibiotic? I love it when parents ask me that. So always feel free to do that. The second thing, is this appropriate for something called a SNAP? And that is a safety net antibiotic prescription. So what that basically means is your primary care provider states, I don't think today that your child meets criteria for a sinus infection, but I think we're close. So if in the next 24 hours the fever doesn't go away, if in the next 3 days the symptoms don't get better, or if this gets worse, they'll give you very specific criteria. We like them to be written down. We're even working on them in my office where there's like very specific, like red, yellow, so the family knows exactly what to do. And a prescription is sent over to the pharmacy so that the family can go pick that up if the child meets that criteria. Now, this takes a lot of collaboration between the provider and the parent, but most parents respond really well to this because I think most parents don't want to try to give their kid an antibiotic for 10 days if they don't need it. So if there's this collaborative approach involved, there's informed consent, the family knows when to start it. I find a lot of times they don't actually start the antibiotic, and then that helps build up their confidence next time when their child might need one. The third question is, are we using the most effective antibiotic but the least aggressive antibiotic? So we have antibiotic uses in children, we don't have that many antibiotics, and we really are trying to be careful with resistance in antibiotics. So there is this misconception in the community that the stronger antibiotic is better. My kid seems really sick, so I want something really strong. It's not always better. And then sometimes the child doesn't tolerate it because there's higher side effects if it's stronger. Failure to complete the treatment leads to more antibiotic resistance and more antibiotics. So we really want to do our best to start with what we call the most narrow spectrum antibiotics so that we are not overdoing it and creating more resistance. We all know amoxicillin, that's still standard of care for pediatric sinus infections. There are other antibiotics to be used in conjunction with discussing with your primary care provider. So those are 3 questions that you can absolutely ask, and we really like it when you do. So I hope this helps as you're going into cold and flu season. Understand when your child might be more likely to have a bacterial sinus infection, when they might likely to need an antibiotic, when is the best time to see your primary care provider. Take care.